Medicare Part A versus Medicare Part B. What are the differences? Hi, I'm Nathan Garcia, and in this video, I want to help you get more familiar with Medicare Part A and Part B by going through what each covers and explaining how they're similar and how they're different. So this video is just for educational purposes only, and it's only meant to be a resource for you. So please don't take any action based on the information that you see here. This isn't financial advice for you, and you should speak with a licensed professional before making any decision based on anything that you see here. So Medicare Part A covers inpatient hospital care. This is going to cover things like any surgeries or any time that you're in the hospital itself. Medicare Part A is going to pick up the cost of that. Now, Medicare Part A is paid for in part with your premiums. You did pay a premium through your paycheck for Medicare Part A, so most people do not have to pay an out-of-pocket cost for Medicare Part A. Now, Medicare Part A is going to cover your inpatient care. It can also cover some skilled care based on, it's a very narrow window of 100 days that you can qualify. But it can cover your inpatient care and some skilled care, along with some other types of care, including hospice care. So it can be very valuable for you, not only because you don't have to worry about the premiums, but also because of the services offered. Medicare Part A does have an annual deductible, and it has a coinsurance, which means that just because you won't have a monthly premium doesn't mean that you're not going to have expenses associated with Medicare Part A. So you really want to be aware of what those costs could be so that you can plan around that. Now, Medicare Part B is going to cover outpatient services. And these are services like just going to the doctor for a checkup or routine visits. Medicare Part B is funded, 75% funded by the government and 25% funded by premiums that you pay on a monthly basis. Now, those premiums are going to vary based on your income and 2 years prior to your filing decision. But it's smart to look at how much your monthly premiums are and look at your annual deductible and your coinsurance. Again, Medicare Part B is going to have out-of-pocket expenses that go beyond just your monthly premiums. So if you're not aware of this, you might find a little bit of sticker shock that first time that you make a claim, because there will be a coinsurance and an annual deductible that will apply. Now, if you look at these expenses and you find that they're too much or you don't know how you'd cover them, then you're going to want to consider a supplemental plan. That might be in the form of a Medigap Plan or even a Medicare Advantage plan. I have a video that explains what a Medigap Plan is and what a Medicare Advantage plan is and how they're different, but those might be options for you if you're concerned about covering those expenses. So Medicare Part A and Medicare Part B are designed to cover the inpatient and outpatient services from a hospital. And the idea behind that is that you can get care from a medical facility for anything varying from, a complex surgery or something that would require you to be admitted to a hospital for an extended stay, or something as simple as a routine checkup. Medicare Part A and B will not cover your prescription drug cost, and that's why there's a Medicare Part D. Now, I'm not going to get into that in this video, but if you understand the basics of Medicare Part A and Part B, then you'll have a better understanding of what you may want when it comes to Medicare Part D and some of the other supplemental plans that I mentioned before. So what are your questions as it relates to Medicare? I know a lot of people have questions about when they file, do they keep their employer benefits, or should they file at their at age 65? What questions do you have? I'm happy to help you out and be a resource for you. So leave them in the comments below, and make sure that you like and subscribe to this channel. Like this video and subscribe to this channel so that you can stay aware of any new videos that I do for you. Thanks a lot, and I look forward to seeing you in the next video. Thanks for watching that video, and I hope that you found the information helpful. If you did, then I'd like to invite you to a special presentation that I put together called The Future of Retirement. This training is going to help you get a better understanding of what you need to do to build a comprehensive retirement plan and the best strategies that you could do so. Now, this training is only 90 minutes and it's going to walk you through the 5 steps that you need to accomplish to build a retirement plan. At the end of this training, you're going to feel more confident and have better direction for what your future holds. So if you're interested in learning how to build a financial plan, seeing what some of the best strategies available are, and how you could implement them into your finances, then go ahead and register for the future of retirement. Thanks for watching this video, and I look forward to seeing you in the next one.